All right, we will be moving to Facebook Live now, and then we'll get started in about 3 minutes.
Okay, Deputy Mayor, I don't want to keep you waiting any longer. I know we have several callers on the line, and Dr. Alvarez also, thank you for your patience. I think we're gonna try to get started here. For those of you calling in, welcome. My name's Henry Stern. I'm your state senator for those of you in the North LA, Ventura County area. For those of you tuning in on Facebook, there will be a link also that you can follow along on YouTube in case you don't have a Facebook account that you want to follow on and participate in the town hall that way. Also on all our channels, we have ways for you to send your questions and some of your feedback from our Instagram, our Twitter, Facebook. You pick your platform. We're agnostic. Look, this is a very challenging moment, to say the least. I think all of us have been touched. I know I have personally, and I think we all know somebody who's hurting out there, whether you're a business owner or an employee who's out of work, or you're sick yourself, or you've lost somebody. There's a huge range of issues we've got to tackle here. Today, we're going to try this format to see if it improves the two-way street for you all a bit, to get better access to our local experts. And we're so delighted to have here today the Deputy Mayor of LA, Jeff Gorell, who handles Homeland Security and basic public safety issues, but is now really spearheading a lot of the city's efforts for the logistics and executing here for Mayor Garcetti. So thank you, Deputy Mayor, for joining us today. We also have Dr. Alvarez with LA County Public Health, who is joining the call, and we do appreciate your time. We know it's incredibly valuable, Doctor. So before I kick it over to you guys for a brief update on your end and go over a few of the questions we've had from our constituents, I just want to give a quick overview. The resource hub that you can go to for any of your concerns, regardless of where you live, is covid19.ca.gov. And I want to thank the governor for his steadfast leadership. It's a time where state leadership is sorely needed. And we can talk about a few of the recent orders the governor's put out. Some of the most important ones in the last few days. There was a health corps order to recruit more people into the profession. There was a moratorium on evictions for both commercial and residential property. Just today, we authorized an emergency $50 million fund for small businesses out of the state fund to supplement the federal program. There's a huge range of issues. Questions about the DMV, for instance. There's a 60-day grace period for driver's license and vehicle registration renewals that just began on March 16th. There will be no more in-person services at our DMVs. The next important piece of information is for retired nurses, doctors, nursing students, medical professionals. As I mentioned, the governor's announcement throughout the state, we're looking for anyone with healthcare expertise to join our health corps. So if you just type in California Health Corps and Google that, it'll take you straight to the resource to see if you qualify today to help in your community. But we'll talk about other ways for those of you without that expertise to help, and other ways for you to participate as well. And if you do have questions during the town hall and you don't want to do it over Facebook or Twitter, just send us an email. My email is senator.stern@sen.ca.gov. So without further ado, I'm going to introduce Dr. Alvarez to kick us off first, to give us a sort of sense of the public health dynamic, especially in the San Fernando Valley and the sort of north part of LA. We've seen some troubling numbers in our sort of Tarzana, Encino areas. Dr. Alvarez, do you mind just giving a quick 2-minute overview on sort of the state of affairs in LA County and your role in this effort?
Not at all. Can you hear me okay?
Yeah, we got you great.
Okay, great. Well, first I'd like to just thank you and the effort that you all are doing at the state level. I tell you, I'm a California native, and I couldn't be more proud of how proactive this state has been. I think this state has definitely has been out there doing an incredible job about getting the message out, the word out, and the resources flowing in all the right directions, I believe. In terms of where we're at, as many of you that are listening in have been following, I'm sure it's hard to avoid the numbers, but they are going to continue to increase, and as you have heard so often, it's just due to the testing and the availability of testing that has lagged so much behind. So now we know the cat's been out of the bag for a while, and now we know it's widespread, and so now we're seeing that as we test more and we get more of those results back. So today, actually, in the press release, we notified the county that we had 534 new cases. Unfortunately, it's really saddened that we have another 13 new deaths as well. So that takes us to a total of 4,045 cases across all LA County, including now 78 deaths. Out in the San Fernando Valley, we've got now another 166 throughout a region that we call Service Planning Area 2, which is Glendale all the way through Westlake. It also includes Santa Clarita, but specifically, I think for the San Fernando Valley, we're about 700 currently. Again, not surprising. I mean, we know it's widespread. The effort, and we'll talk some more about that, is what you all are doing out there. Quite honestly, that's going to be the most effective tool, is what you heard over and over again about flattening the curve. But we're very much engaged with the Emergency Operations Center. Our staff, our public health workers continue to focus on identifying cases, isolating those cases, working at quarantining known close contacts of those cases. And now especially we're focusing in where we know, we've been doing this for some time though, over the last couple of months, focusing in on those vulnerable high-risk settings where we know we have seniors and individuals with high-risk chronic medical diseases. So we've been working very, very closely as we get more and more cases in those settings as well to provide advice, make sure we can mobilize resources and support those areas such as long-term care facilities, SNFs. Unfortunately, we've got cases now in homeless. Probably heard about the shelter downtown. And trying again to mitigate the best we can in those settings and isolate individuals. And then, certainly the messaging that we're trying to get out there to the community to stay at home. You've heard many of our health officer orders out to the community, closing non-essential businesses. Certainly painful for many. I could feel that as well. And just getting folks to again, stay at home and do social distancing and be smart about it. You could, certainly help us. And we're only as strong as our weakest link, we keep telling folks. So we're all in this together. I'll turn it back over to you, Senator.
Doctor, how would you grade our effort in terms of flattening in the region right now? I know there was sort of a report card out there, but we keep trying to find those loopholes. I mean, unfortunately, there's still, areas and individuals sometimes that haven't heard the message yet for some reason. And so we have, as you know, we've closed trails, we've closed beaches, but I think we're getting better at it. I'm hearing back from both CHP, police, fire folks, and they are all, noting that there has been, kind of, market improvement in terms of social distancing and folks staying at home. But we do have areas where we could continue to improve, and we're seeing businesses step in line with that as well. I'm sure many of your listeners, when they're going out, are seeing businesses now comply with social distancing within their own business that's open as well. So it's like we're improving a lot. So I think I got to hand it to folks. I know it's difficult, but I'm seeing some really good improvement out there. Well, I've the consequence in mind is I've taken over my living room now, and my wife has now subjected our home to become a personal office. But we appreciate Deputy Mayor Gorell coming to us from our city's operations center in a little more formal setting at the hub of the command. We know you've been in the room, as it were, for the last few weeks here, Deputy Mayor. Can you give us just a quick snapshot of your day-to-day and what you've been doing for the mayor in our great city?
Yeah, thank you. First of all, I want to thank Senator Henry Stern for his partnership and leadership at the state level, and for inviting me to represent the city family on today's video call. So thank you very much for helping us get the word out. Mayor Eric Garcetti took an early lead nationally by being one of the first mayors to declare a state of emergency. And we've issued a number of orders since this started now more than 20 days ago in terms of the emergency itself. Synced up in many ways with the county and the state of California, and guided by the recommendations of our public health officials. We've done everything we can very early on to limit non-essential activities and gatherings, and to encourage people, frankly, to just stay home and stay safe, as you have in Sacramento on a statewide basis. Some of the key heavy lifting that we've been doing as a city on behalf of its residents, and frankly the entire LA region, we've been taking the lead on hospital surge, or a hospital overflow plan, which is to prepare for the anticipated overflow that hospitals will receive in the next few weeks and months, related to the number of patients coming in and wanting to receive care, not just for COVID-19, but for all of the maladies that affect us as a society. On top of that, that overflow plan included working closely with you, Senator Stern, and the governor to try to get the USNS Mercy, the naval hospital ship, to port here to take some of our offloaded patients from hospitals, low acuity and just acuity patients that aren't COVID-19 positive. So that was successful. Thank you for the support from the state in that. And then to also begin the process of building out the Los Angeles Convention Center downtown, for example, to be an overflow for hospitals, for low acuity patients that can be taken care of there rather than in hospital beds that'll be needed for much needed life-saving treatment over the next few weeks. That hospital plan is now a multi-jurisdictional partnership that includes the county of Los Angeles, the state of California, and National Guard and FEMA. So we're moving very well along at that effort. We've got a multi-pronged homeless strategy that's being executed citywide that is an effort to get our very vulnerable, unsheltered population out of the dense encampments, which could prove to be very disastrous in terms of the spread of a virus if it really were to catch a toehold, and to get many of those homeless individuals into our various shelters and eventually to hotel rooms, which we're lining up, working closely with the county and the state of California on that as well. Thank you for your support there. And then kind of the last big area where we're working on is support to the community. And that comes in various different ways. That comes in our efforts to, for example, Mayor Garcetti got out thousands of masks to some of our smaller grocery stores so that our grocery store workers could have masks when they come in and they're available, which is not all the time, but when they do, we get them out to our members of our public who are out there working, who are part of our essential workforce, providing food, providing healthcare, providing water, deliveries, and those kind of things. We're also working very close to the small business community to provide loans from the city of California, but also working to make sure we get the word out on other small business and employee support that is coming from the state of California. as well as the federal government, and making sure that everyone has got the information they need to connect with those important resources. The mayor, in addition to the many orders that he's issued already to try to keep people at home and to limit the non-essential activities and gatherings, the mayor has declared an eviction moratorium. We want to make sure that people who are not forced to stay home do not live in fear of being forced for their home simply because their business has currently been on a shutdown or not working. And lastly, a lot of public education and outreach, educating the public about what to do and how to do it, when to wear a mask, and when to exercise social distancing. A lot of education there, working closely with the county public health, Dr. Alvarez, state of California, and then also enforcing. We all have to do this together, and many people on this phone call are doing their duty, staying home, only going out when it's essential, and exercising social distancing and those kind of things, but not everyone is. So we're also doing enforcement, and that includes criminal complaints that have been filed in the city of LA against some small businesses that have been warned repeatedly to stop their non-essential activities, and yet have failed to do so. And we also have the authority now to turn power off or water off to those establishments, or both, if they continue to be non-compliant. So that's kind of the universe of things we're working on here in the city. I do want to mention one other thing, is that Mayor Garcetti, at the direction of the mayor, we launched a number of test sites for members of the public and our critical workforce to be prioritized to receive free testing at a number of different drive-through locations and now one walk-in location. Those tests are reserved for the most vulnerable. The most vulnerable are statistically those people who are symptomatic, and those symptoms are consistent with COVID-19, and who are over 65 years old, or who have pre-existing underlying medical conditions that make them vulnerable. For those people, we have tests available at 9 different sites throughout the county. 7 of those are in the city. 2 of them are in the valley, and we have appointments that are available, and people can find out more about whether they're eligible for a test by going to coronavirus at lacity.org. It's coronavirus.lacity.org, or simply Google searching City of Los Angeles coronavirus. We'll get you set up with an appointment, and then you can come in. We're also testing our critical frontline workers. That's our EMTs, our police officers, our firefighters, our public health workers, and our social workers that are working in homeless communities and with other elder care facilities. So all of those things and more the city's doing with the support of the state of California and people like Senator Stern. So thank you.
Thank you, sir. Hey, I wanted to come with you just one quick follow-up on the enforcement question. We're gonna pivot over to public health in a second, but Matt from our Facebook Live feed had just asked, is there a hotline folks should be using if they're seeing, say, a non-essential business operating flagrantly in violation of the orders? Is there some way citizens can help you be vigilant here?
Yeah, no, great question. Thank you, Senator. There are a couple of ways. First of all, we would just ask those people, unless it's an emergency, don't call 911. There have been a number of calls to 911 about violations of these orders, and these are obviously actions that we want to limit or prohibit, but these aren't necessarily emergencies. So the first step is not calling 911 unless it truly is an emergency. Secondly, there are publicized numbers for Los.
No, we may have just lost your audio, Deputy Mayor. Can you hear me okay? We have a little technical difficulties. Can you hear me, Deputy Mayor? All right.
I hear you, Senator Stern.
Okay, he may have just fallen off. We'll come back to you, and what we'll do is we'll post the link that you just mentioned on our feed here, so that folks know where to go, both on the testing site locations and then on this tips line or the hotline number in lieu of 911. While you sort the audio out, let me go over to Dr. Alvarez on our first public health question, if you don't mind. Thumbs up. You can hear me?
Yeah, I'm still here.
Okay.
In fact, before you ask me the question, and unless the deputy is back on the line,
yes.
My understanding is you could call 211 as well, and there's an assessment that they will do to see if you queue into those criteria for the testing, and then they issue a number, is my understanding as well.
Okay.
So if you don't go to the site, yeah, you
Okay.
can call. You can call.
So let's get into that testing question then. That's a perfect segue, Dr. Alvarez. So there's a lot of people out there say, I have maybe a cough, or I have light symptoms, but I'm not sure. What are the guidelines and best practices? When should people really be seeking a test and seeking these resources? And maybe even more importantly, when shouldn't they be seeking a test? And we got you back, Deputy Mayor.
Yeah, let's put it this way. Someday when we have testing for everybody, like we do with the flu test, yeah, I mean, even with the sniffles, I'm sure that they'll be tested someday because it'll be that prevalent, the testing. And but because of the situation we're currently in with a very limited amount of testing, still, I mean, again, looking at a population of 10 million in LA County. And across the nation, I mean, it's the same everywhere, quite honestly. It really does need to be reserved, as the deputy mayor was stating, for those that are the most vulnerable, those that we know that if they've got those symptoms and they've got, the over 65 medical conditions, the pregnancy, the whole checklist that they go through, they're on a much slippery slope that could slide really, really quick right into the ICU, right onto a vent. And so those are the folks that we really want to test and identify early. And we want to reserve the testing stream for them. The others, they keep in mind, I mean, you're hearing certainly the tip of the iceberg, and it's really tragic with all, the hospitalizations and the deaths, certainly. But the flip side of that is that 99% of folks do recover through this. I mean, they may get hit with some symptoms. They should be contacting their physician. They should not just be going into an emergency room to get evaluated just for, a slight temperature or what have you. But again, they should contact their physician. Certainly if they have any of these conditions, certainly if they meet any of these testing conditions, they should get tested. So that's where we're at the moment. Someday, we will have the test everywhere, and hopefully it'll be an easy test for anybody to get, so they can get identified early.
And so just to be clear, the first resort shouldn't be the ER or the urgent care center unless you have what feel like obviously serious conditions, and then you should be pursuing it just like any other life-threatening emergency. But short of that, it's a call first to your doctor if you have one. What if you're uninsured and you feel symptomatic? I know we had a tragic case in Lancaster. Young man went into his emergency room, and the interaction resulted in him leaving. And large part because he didn't have insurance. So any insight on that, how LA County's hospitals are operating and folks are uninsured? Do they still have any of these services at their disposal if they're really in a life-threatening situation?
Absolutely. I mean, and we've been working overtime as well to try to make that clear to all folks in with our Office of Immigration Affairs and Services for those that and those that just don't have insurance. Period. That they certainly testing is free. Any of the testing you heard about from the deputy mayor, those are all free. So certainly, if you meet any of those criteria, there's no cost with those testing. At any of our county clinics, Certainly, there's no charge there either. They are certainly, paneled to be seen there. And then there's certainly the nonprofit healthcare centers as well that should see them. I can't speak to what the incident up in Lancaster. It sounds like that should have never occurred. But they should have, they should attend to somebody who's in need and evaluate them, and then care for them as appropriate, or test them as appropriate.
Understood. Thank you for that clarification. Neil from Facebook had a question about how many tests have occurred in LA County, but why don't we wrap that into your response, Dr. Alvarez, just for sort of the general state of resources in our region. There's a lot of questions that we've been getting about hospital beds, ventilators, how prepared are we for this surge? So can you sort of talk to maybe how many tests, how much testing has been going on in our region? And also, in addition to testing on the care side, what does the resource situation look like?
Yeah, I know we're ramping up. I don't have the exact number on all the resources. I know that those are being managed, managed by the hour at the Emergency Operations Center, and they are, there's the emergency, the EMS folks that are looking at capacity when it comes to supplies, from ventilators to bed capacity to, certainly monitoring our surge capacity. I mean, it's a great fortune that we've got the Mercy in now in the LA port. That's an incredible asset there as well. In terms of testing, I do know that we keep we're like at 20,000, which obviously doesn't sound like a lot, but from last week we almost tripled. So there's tens of thousands more testing that's coming out over the next several days at all these various sites. There's you probably read about it or heard about it. There's now a rapid testing sort of machine that's small that certain centers could have to make testing, the turnaround on testing, a lot quicker. So we're hoping those get out in the next several weeks as well. I think within the next couple of weeks, we should be seeing tens, if not hundreds, thousands more testing in our county.
And sorry to interrupt you, doctor, but is that what they call the antibody test? Is that the short-term turnaround? I know Kara had that question from Facebook. Is that the short turnaround test you're talking about?
Yeah, I'm referring to the Abbott test that was recently FDA approved, and it's a fast rapid cycle test. It is there is antibody test as well. This one I believe is more on a PCR based platform, so you get like a lot higher sensitivity and what we call specificity, and it could turn around a result, a positive result within 5 to 10 minutes, a negative result within 10 to 15 minutes. So that I think is going to really make testing a lot more accessible, because that's the other piece that people, unfortunately, there's a lot of miscommunication about it, because the testing itself, it's actually just sample collection. The testing goes back, that sample goes back into a lab, whether it's a Quest diagnostic lab. We do have more commercial labs doing the testing. So there's Quest, there's Unicorb. We do some at the county lab, obviously, but that's where the bottleneck is. I mean, we could swab till the cows come home, but if the testing bottlenecks back at the lab, because they can only process so many samples with the reagents and the kits they have, that unfortunately was the delay, and that was the bottleneck. And now we're certainly amplifying the labs, and then with this Abbott test, and there's going to be obviously several others that might be similar, it'll be that much more rapid that you'll have a result. You don't have to wait. Currently, I mean, it's really sad to hear, but currently the wait time through many of our labs is 5 to 7 days, and we really need hopefully to improve our capacity to get results a lot sooner.
Is there a sort of general thinking on the likelihood? We had a question from Mike McManus about the the surge capacity of Mercy in the convention center. Can Deputy Mayor or Dr. Alvarez, can you just tell folks, for those who don't know about the Mercy and what it's going to do in terms of capacity for Southern California, can one of you weigh in on that? I know it was a huge win for those of us down here who may need it, but what will that be used for? And might we exceed that capacity in addition to the convention center? Some of these other sort of auxiliary units we've been bringing online?
Maybe I'll, can you hear me?
Yeah, we got you.
Okay, thank you. Maybe I'll just start off and then let Dr. Alvarez jump in. But our early assessment in working with the hospital association and with the county was that we might end up in a situation where we're about 11,000 beds short. That includes ICU beds and traditional hospital beds for just acute care. The Mercy provides an off-ramp for just non-COVID-19 patients to be transferred, which would include things like broken legs and or broken bones and things that could be fixed outside of a hospital environment, free up that facility to focus on COVID-19 patients. The USNS Mercy, which is now down in San Pedro at the Port of Los Angeles, has about 1,000 beds. So it does cover some of that potential deficit of 11,000 beds that could be needed. The LA Convention Center is currently built out to be 250 beds. We've got plans to expand it to 500 beds. And then if absolutely necessary, could be as many as 6,000 beds. So that would be just about the entire convention center, and that would have to require support from major organizations out of the federal government like FEMA and possibly military support to get us to that full capacity. So the Mercy plus the LA Convention Center still doesn't get us to our bed deficit of at or about 11,000 beds. The way we get there is working with the hospital surge plans. The hospitals, the larger ones, have their own surge plans, which include possibly putting out tents nearby in parking lots and moving kind of low acuity patients out there, or patients that are soon going to be discharged that did free up room inside, and then any other kind of contingency operations that they have set up as individual hospitals or collectively. So that's what we're working on with the county and the state of California all day today, is what does LA Convention Center look like in a week from now, a month from now, 6 weeks from now, and so on, as a potential build out. We hope we don't need 11,000 extra beds, but we want to be prepared for any contingency.
Understood. Thanks for the math. Math matters here. Dr. Alvarez, did you have any additional comments there?
Other than I actually drilled on the Mercy. This was about 10 years ago when we were doing a regional. This was for the pandemic, when we went through the last pandemic. With the H1N1, and it's an incredible asset, and I'm just glad that we've got it off our port at the moment.
Yeah. So let's keep going through this round of health questions. I know that Angel's question about will we be getting more testing kits in Los Angeles, I've already heard through your comments. The answer there is a resounding yes, and we've tripled since last week, and we're going to be expanding capacity even more so. I know Kevin's question about those without insurance, for whatever reason, that you answered that, Dr. Alvarez, that if you have an urgent medical situation, you can go regardless of your insurance situation. A couple others that I just wanted to ask you both about. This one might be for the deputy mayor, but best practices for when you're leaving your house. You're walking out and you're on your way, say, to the market or an essential service you've got to pursue. Should everyone be wearing some kind of mask out of their house? It might be for Dr. Alvarez as well, but what are the best practices for those who are in a position to leave, go pursue their essential services and come home? How do they go about those basic chores?
Well, the mayor's
I'll start. Bro, why don't you go?
Okay.
Yeah, why don't you go ahead?
I was just going to say, yeah, Mayor Garcetti's been advocating the use of masks when people are out and about, but not the surgical grade masks, and certainly not the high-end N95 masks that are in very limited supply for our first responders, our doctors, our nurses, our EMTs, and they're so limited that we're asking people not to try to get those because those really aren't needed by people going out. What has been generally suggested, and the mayor has been emphasizing it in his nightly remarks on live TV, is that any kind of a face covering, whether it's homemade or cloth or rewashable, provides some level of protection, not necessarily for yourself, but for others, if you happen to be somebody who either knows that they're positive for COVID-19 or doesn't know but might, be asymptomatic and a carrier. But that kind of behavior of wearing simple face coverings generally is what we're understanding is highly recommended. The mayor's been talking about it a lot. So I'll turn it over to the subject matter expert from public health.
So, you stole my words. I think it's really important for folks out there to know the difference. The N95 masks, we should reserve those just for healthcare workers. I mean, those are all we've got. They're in limited supply. They're very effective for folks that are going face to face with treating folks that have this virus and many other infectious diseases that they're caring for. Surgical masks as well. I mean, that's in that same category. And then we know just that it's not for others. Many times, it even causes we're telling folks not to touch around their nose, their eyes, and what have you. And we've noted just through behavioral studies that folks wearing masks tend to fidget with their hands in their mask a lot as well. So sometimes it even makes the situation worse, quite honestly. I agree with the city. I think the city and is in the state actually. They've made recommendations where it does make sense in some situations to start looking at covering up with a cotton cloth, like a bandana, something along those lines. So there are recommendations that went out today, I believe, along those lines. When you go out and about for essential services, it probably protects, if anything, because we know there's now, like the deputy mayor mentioned, there is a 2-day, a 48-hour period before you display symptoms that you could be infectious. So that's a bit of a game changer, and that's why sometimes you wouldn't even know a day or two prior that you're possibly infecting somebody. Although you wouldn't be a very efficient spreader because you're not coughing obviously a lot and spreading these droplets, but
right.
you could spread, and so that's part of the recommendation along those lines. With that in mind, however, it's also very important to know that's all the more reason why we need to stay at home and just go out with essential services. And wearing anything in public doesn't replace the effectiveness of all the social distancing.
Sure.
If you look at models, it's the social distancing that'll get us where we want to get, and it'll blunt that curve.
Right. No, certainly people should not be congregating in bandanas. I do not think that's the implication, but when you have to leave your home, if you have N95s in a stockpile, what I'm hearing from you, Deputy Mayor and Dr. Alvarez, is you should not be holding on to those N95 masks. We should be getting those into the hands of the frontline healthcare workers and others, but that sort of makeshift, the homemade mask, cloth, basics, if you're going out to, say, the grocery store, or you have to be at the pharmacy and you don't have symptoms, but standard practice, as long as it doesn't mean you're going to be rubbing your eyes or fidgeting with it too much, we should all be trying to adopt some form of protective wear when going out into public. So hopefully it'll become the new style. I'm working on my own custom version here. And if you guys are interested, we actually, there are a lot of sort of mom and pop operations making non-medical grade masks. So please do let us know if you're interested. But on that note, we have had a few registered nurses weigh in on our feed here, and First, just God bless them because they're all we got right now and they're putting themselves in harm's way. But in terms of the PPE process, what we shorthand call PPE, it's our personal protective equipment, getting those masks to our nurses, our doctors, the frontline workers who have to sort of be there interacting with people all day. Any comments on efforts locally to acquire more? I can comment also on the state side of things, but I thought I'd ask you all from county and city just on PPE in general. Do we have a status update there?
We have a PPE team here on the emergency operation floor. I'm just going to show you here. We've got folks working around the clock, 7 days a week on emergency operations. We have a PPE team that is working closely with the hospital associations and then the individual hospitals to make sure that, that first of all, we are all working together because, you know, what we find in situations like this is that mutual aid is not necessarily applicable to outside areas. We're all kind of bidding and trying to get the same stockpile of masks and bidding against one another when the end result is that we want to support the county and the county wants to support the city and we all want to support our hospitals and we're all one team. So we're trying to, you know, work together to make sure that we're finding where the supplies of masks are, where the production locations are that can produce large amounts of the you know, the healthcare level certified masks like N95 and KN95s and surgical masks, the gowns and the face shields and things like that all make up PPE, and that we're getting the right information to all the right people. We are ordering extra PPE here so that we can distribute to our hospitals and working closely with the county and through the county to do that. The hospitals themselves have their own procurement process that goes through the state of California. And that is also in full effect, a machine that's working very hard and diligently to try to get the hospitals the protective equipment that they need. So Dr. Alvarez may want to add to that.
Yeah, not much to add to that. I mean, you guys really, you know, it's all through that system aligning through, you know, the Emergency Operations Center and acquire resources through mutual aid. I mean, unfortunately, that's the challenge with pandemics. I mean, if it's a fire in one location, you can always bring in mutual aid from all over. You know, we're all challenged, you know, from coast to coast on this. So, yeah. But we've got a really good team, I'll tell you, really communicating well, and I know on the front lines with healthcare workers that when I'm in clinics, I mean, we're trying to extend the use of these masks. I mean, it's not something obviously we typically want to do, but you know, we now doing more extended wear through the day and then disposing them when we feel like they're no longer usable in a sense.
Understood. And I will say, I know the governor's there is a large order coming in from both county, city, and state. But I also wanted to tell folks tuning in, we've got some really generous offers from members of the public who either have small stockpiles, anything from, you know, you were saving 10 N95 masks from the last flyer, to, you know, larger stockpile, you're in a church and you have 1,000, or you might know someone you think who can manufacture these, that a fair amount of our business partners reach out. Know that we will be channeling it into the same exact central pipeline that the deputy mayor and the city of LA are operating from, and from county. So any door you knock on with that resource, it will get back to the front line. So you know, if it's a matter of reaching out to our office, their office, whomever it is, let us know if you have those resources, and we will get them. And I know LA County is moving inventory at 4 of their hospital locations. We will find a way to get that out in the field. So please keep offering small and large if you have knowledge about it. But we're also going through the traditional procurement process that they both spoke about. Do you all mind? Can we pivot to just a few more questions? I know we only have about 10 minutes left here. There have been a few questions about the homeless population. Kim from Simi Valley was asking about Ventura County motel that they were using to allow distancing, wondering if there's similar stuff going on locally. There have been a number of questions about our Lake Balboa area, where we know we've had ongoing encampments and people really have nowhere else to go but kind of keep getting shuffled through the system. Any comments in terms of opportunities within the city maybe to have alternative shelter options than being out there on the streets?
Yeah, we have 20 recreational centers that have been stood up already in and around the city for our homeless encampments to move into, and we're moving people into them. Can't do it all at once. We're doing welfare checks on individuals to make sure they're not exhibiting any of the symptoms, and then we are transporting them over to the right rec centers and cataloging their personal belongings so they don't get separated from them. So it's a process. It's a huge process, and we're going through that right now. But we have upwards of 20 rec centers currently open, and I'm staffing them with city employees from the Department of Recreation and Parks. Parks are closed, so our employees have shifted over to man these homeless centers. We're also now distributing COVID-19 testing capability to the areas of Skid Row and other encampments where nurses and other practitioners can take tests for those that might be exhibiting symptoms, and they make sure that they're isolated from the other populations for the fear that the homeless community might be an area where this could take hold and really spread. We're trying to avoid that. So a lot of things going on. There's also a portion of the LA Convention Center that could be used for even additional capacity for those that are experiencing homelessness. And we're looking at other places as well throughout the city. We're working closely with the state of California to identify ways to lease entire motels that are underutilized or unutilized, and then use those hotels for housing our unsheltered population and just frankly keeping them isolated and away from the congestion of encampments. So there's a multi-pronged strategy. It's been unfolding for a couple of weeks now, and will continue to unfold for a couple more.
So is that amongst those park resources, fair to say a few of those are in the San Fernando Valley?
You know, I believe so. I have to double check and circle back, but that's the goal. Certainly is to be out to 41 rec centers throughout the entire 48 rec centers throughout the entire city. Okay. And if we don't go from 20 to 48 throughout the entire city, it's a strategy of hotels and motels, and that is definitely a citywide strategy. Yes, including Nevada.
Great. So those of you following, we will be sure to get follow-up information on that so that you all are aware of that resource, and obviously can call 211 or city if you know people who need that kind of help. I wanted to drill down a little bit on the safer at home orders, and there's rumors going around about how exactly they'll be enforced. Can you give us a bit of perspective? I think Deputy Mayor, this is probably best directed to you, how law enforcement is dealing with our stay-at-home orders in city. And Dr. Alvarez, you may have some insight on a sort of county sheriff's perspective, but is this the kind of situation where if you're a pedestrian on a wellness walk or on a bike ride, say around your block to get a breath of air, will you be cited? Is law enforcement going to go out and enforce at that level? What does enforcement actually look like on the ground for our residents?
You know, we're encouraging people to stay home because they're safer at home. We are looking to direct our resources in terms of law enforcement, and we also have a team of people we call the mayor's ambassadors, and these are just city workers who have been empowered to distribute literature throughout the city to different small businesses, for example, that may not be complying with the shutdown order. And really, the first prong is education. So there's very little initial enforcement of this, except for those businesses that, after repeatedly being asked to stop running a non-essential business, continue to do so. We have a number of different enforcement capabilities. In terms of people being outside and going for a walk or recreating, that is something that we, at least in the city of Los Angeles, are not enforcing right now through law enforcement. We're doing a lot of education. We've got people out there that are handing out educational flyers. If you're showing or exhibiting or exercising social distancing, it's not something that's going to give us concern. And not something that you'll see a Los Angeles Police Department or other enforcement officer taking action on. But if you are throwing a house party, that would come to our attention, and we would enforce against that. If you are opening a vape shop and you're not complying with the shutdown orders, or you've opened up a back door to a small bar or a gym, those are the kind of violations that we're focusing our enforcement resources on right now, not on individuals walking about.
Understood. And I know it was a tough decision for all of us to shut down some of our trails and parks and other public amenities, including the beaches. And we struggled with it initially, but I'm an avid surfer, and the waves are actually good right now, and I am not going. And we saw Ventura County line packed today, which is huge cause for concern. But those of you out there who are doing reasonably socially distanced breaths of fresh air, that kind of exercise, it has to be reasonable, and please try to do your part, because we really did put a lot of people at risk with the kind of behavior we saw going on the previous weekend. We did a little better this weekend. We think we got ahead of this, but even to my friends in the surfing community out there, know that this is not the time to go get those waves. Find another way. Dr. Alvarez, any quick comment there?
No, I believe we're in lockstep with the city. So, the deputy mayor, explained it quite well. I mean, that's my sense of the county approach as well.
Okay, great. We keep here, everyone knows the toilet paper, supplies, grocery stores, the talk of shortages. We've heard these rumors abound that people ask about food shortage, if it's toilet paper and sanitizer, what's next? Any perspective on whether you're seeing an issue with supply? I know that's really not the core purview necessarily of the city or the county, but I do know the mayor has been out there looking at sort of the supply side of things, and we have engaged certainly with those who have access to food issues and hunger vulnerability. The National Guard has also been deployed to help with our food banks. But Deputy Mayor, just a quick comment on state of play in grocery store land. Are we still okay going to the market and trying to get the basics?
Yeah, I think communicating almost on a daily basis with the Grocers Association, there's plenty of food. There's plenty of food, and we've been to the distribution centers where the community stores get their supplies, and there's plenty of food there. There is a run on some items just out of anxiety. That run is, people know, is toilet paper and hand sanitizer, canned foods at times, but there is plenty of food, to follow through, and we're, the county and the state and the local and the city all have the ability to kind of watch the supply chain, and it's not a concern right now, at least not for the city of LA. But again, I think we'll hopefully get to the point where this new normal has allowed people's anxiety to settle to the point where they're not making a run on these items, and we're just restocking the shelves as normal. But you will see some of these items gone for the next few days and maybe weeks pretty quickly off the shelves. But it doesn't mean that there's a lack of it, and the stores will get it back up there.
Understood. Thank you. I know we're getting close. We're at the 6 o'clock hour. The one last sort of range of questions we've been getting from folks is about people who need help, especially seniors. We've been getting a lot of questions about seniors who may be home isolated, in need of food, meal delivery, other services. I at least wanted to let folks know the governor and throughout the state with an agency called Cal Volunteers has started a neighbor-to-neighbor check-in campaign to make sure that you're checking on vulnerable seniors you may know, and you can actually access it through Nextdoor, as well as at serve.ca.gov to hook you into a program where you can essentially call people or knock from a safe distance or text them if they are so technologically evolved. So that initial step of you calling and asking about need for food, prescription, or supplies, and doing that on an informal basis is huge. Then letting us know that you've found needs is the next step. But there is also a formal effort, as the Deputy Mayor and Dr. Alvarez put out, to check on seniors and those who have food instability issues and maybe homebound, also those with disabilities and others who are getting in-home supportive services to do that checking. Can you just talk a little bit about how we're checking on people, especially our most vulnerable, to make sure they're okay? And at least from a physical health perspective, we know there's sort of mental health issues around this isolation too, which we've got to start tackling. But just a brief input on how we're dealing with that population.
Well, I'll try to be brief, but again, we've been working, I know with the city as well, on 211 resourcing and getting those folks, really on lockstep with us and all the resources out there for wraparound services and seniors. So certainly, avail yourself to 211 and find resources that can help you that way. I did mention, that is certainly a targeted population for the public health department. And we've been looking at those that are, again, in those settings, those licensed care facilities, assisted living facilities. We've been very proactive with many of our staff to hit virtually all of those centers throughout the county and cities to provide advanced guidance, resource numbers for them as well. So most of our focus has been along those lines in those particular settings.
Understood. And Deputy Mayor, other ways for people to help? We know there's the Mayor's Fund, some other initiatives out there. If folks want to pitch in their time to help these folks, anything they can do to work with Mayor Garcetti and your team here if they live in the city or otherwise?
Yeah, thank you. But before, I'd like to just make a quick note on the elder care. We have started to get testing out to some of our elder care facilities, especially the larger ones where you have a high density of kind of vulnerable seniors. And recently working with you, for example, we were able to get some testing out to a very large facility in Reseda and get them the testing they needed to identify if some of the residents there were positive for COVID-19 and could be then separated and isolated and get the care they need to be healthy. And that's great. So thank you for your help there.
No,
Thank
you. It's amazing to watch government work. I mean, when you see a crisis break out and then you call the mayor and the mayor picks up the phone and he fixes it, it's a restorative, hopeful process. So thank you.
Well, it was through that and other doctors that are in a network called CalPACE that provides elderly care throughout the city and the county. We've been able to get a network going for these test kits and get them out so that the providers in these various elderly care facilities can do some testing, send them in and get the results, and then be able to provide the care they need. So that turned out really well. The mayor, Eric Garcetti, is asking Angelinos to consider supporting the effort countywide with two different funds. The first one is the Angelino Fund, and that is at mayorsfundla.org/Angelino. And that's, again, mayorsfundla.org/Angelino. And that is with assistance for families experiencing extreme financial hardship. We're raising money there, and that includes especially immigrants or independent workers who may not qualify for some of the other benefits that are being put out there by the state of California and the federal government. There's also the COVID-19 Crisis Fund. It's a flexible funding to, if you put money into this fund, it'll provide child support for our medical personnel, our nurses and our doctors who don't have an option for childcare, so that they can safely and comfortably leave their children with childcare, so that they can be on the front lines and be our first responders in our hospitals and care facilities. There's information there at mayorsfundla.org/COVID-19. That's mayorsfundla.org/COVID-19. And thank you very much for the opportunity to get those out. We're raising a lot of money is going directly to folks with that need it the most.
So we will get those links posted and distributed to everyone on the phone and Facebook, Twitter, Instagram, etc. And please, the simplest way is just come through the front door. If you're sitting there idling and you're you don't know how to pitch in and you feel powerless, just reach out. There is a huge amount of need. Even if you can't get off your couch or write a big check, there are plenty of ways for you to help us flatten the curve from sitting at home and staying and taking care of your family. It's about 6:07 now, so I know there were a number of other questions. Questions about eligibility for paid sick leave, questions about helping those of us who have friends or family with disabilities, how to visit them in the hospital. There's also questions about how the stimulus package would work, small business owners asking questions, or those filing for unemployment. We will be following up with some specific economic recovery forums here with some of our other local experts. So please know that we will get to those questions in the next few days, and we'll hopefully bring some experts online to workshop through this. We wanted to experiment with this open format here and see how it worked for you guys, and really focus on health and safety here today. And for that, we're so grateful to Dr. Alvarez and Deputy Mayor Gorell. I really appreciate it. I want to let you guys get back to your emergency work. We'll stay on with our constituents here and make sure we're gathering up questions. And together, hopefully, we'll get through this. It's going to be a hard few weeks, and I know we're not out of the gates yet. And everyone wants to know when. Let me just close. The closing question would be that do we think that we'll just return to, say, business as usual by Easter? I know that date was thrown out by some friends of ours back east, but can I get a realistic assessment before we close? Is this sort of safer at home world probably going to continue beyond the Easter, or for those of my friends who are looking forward to Passover after the Hog? Dr. Alvarez?
Yeah, unfortunately, I suggest you continue to listen to Anthony Fauci. He's an exceptional scientific public health mind who's advising the president, but also, unfortunately, he as well, has looked at those models that are going to take us through to the end of April. So we're looking, weeks, possibly even months. It's going to get rougher. You're right. Next 2 to 3 weeks, and we could, but we each individual could control the impact, and we've got to stick with it. I know it's tough, but we got to stay strong.
Agreed. So you're not alone, folks. Next time we're going to experiment with your ability to actually video yourself into this Zoom. We were worried about the Zoom bombing trend, so we didn't allow a totally open format here, but stay tuned for our next town hall. We may even find a way for you to lob your questions in live over video. But Deputy Mayor, any closing remarks? I want to let folks try to get to dinner time here, and you yourself get back to the operations center and take care of your family too, if you have any time to do that. Did you want to close?
I just want to say thank you, Senator, for the opportunity to get the word out. Stay home, stay safe. Practice social distancing, wash your hands, don't touch your face. These things you hear over and over and over again are the 1, 2, 3, and 4 things that are going to save lives. So thank you, everybody, and stay strong.
Okay. Thank you, sir. Yeah, those of you who are looking for a baby shark redux, wash your hands. It's quite good. If you need a helpful hint, but the world outside should be reminder enough. I'm going to cede my living room back to my family here, and appreciate you all tuning in. We'll see you real soon.
Thank you, Senator.